Local doctors are calling it a pacemaker for the brain. Medical reporter Robin Duane tells us about new technology being tested here in Rochester that may help prevent seizures in people with epilepsy.
Well, Janet, this is the technology that we're talking about. It's really about the size of a small lighter, but it's really a computer in here, and it's put in the brains of people with epilepsy. Doctors here want to know if it can stop a seizure before it even happens. A local man is one of the first in our area to test this breakthrough device.
Sometimes I wander and I would...
Paul Herzog had to give up driving, worries about riding a bike, and had to change jobs, all because of his epilepsy. He has struggled with seizures since his early 20s.
Every 3 weeks I have a flurry, and over a course of 3 to 4 days I have approximately a dozen.
Surgery isn't an option. Medication helps, but until this summer, Paul had little hope of ever being seizure-free.
It's frustrating, aggravating, but I'm so used to it that it's just life, you know.
But this may be the answer. You can call it a tiny pacemaker for your brain. You may be familiar with implantable pacemakers and defibrillators commonly used now to help detect abnormal heart rhythms and deliver an electrical stimulation to correct problems. This little device is designed to do the same thing, only in the brain.
There's never been anything like this.
Dr. Michael Berg is a neurologist with the U of R Medical Center. The U of R is one of 27 centers testing this new technology in people with epilepsy to see if it can prevent seizures from happening.
This is the most advanced technology for the treatment of epilepsy or seizures that's ever existed. And it's because of the miniaturization of computers that allows this.
The device is implanted on the brain's surface in the area where seizures occur. It continuously monitors Paul's brain waves, and when seizure activity is detected, the device delivers an electrical stimulation to stop the seizure within seconds. Paul had his device implanted in July as part of the study. He doesn't know if it's turned on or not, but by the fall, all patients in the study will have their devices on. Either way, Paul says he's hopeful for the future.
Yeah, it's fantastic. I mean, 5 years ago, that seemed like science fiction.
Only about 200 people nationwide are in this study, and if it's successful, the device would be used along with medication. This certainly offers a lot of hope to people who just can't have surgery. Just think it's all pretty tiny.
Mentioned science fiction. This must be where pacemakers for the heart were 20 years ago.
That's what doctors are saying. Because they had to miniaturize it, that was sort of the problem. They needed to get it smaller to kind of keep up with the pacemakers. But certainly, we see how far pacemakers have come for people with heart conditions. Really offers a lot of hope for people with epilepsy that maybe in 10 to 15 years they would have this and wouldn't be so dependent on medication or surgery. So really incredible.
Good thing.
Yep.
Robin, thank you. Well, epilepsy is a common neurological condition. It affects 2.5 million Americans of all ages.